Hi, everybody. This is Cassie, and I am presenting to you on functional behavior assessment, also known as an FBA, and behavior intervention plan, also known as a BIP. So the first thing I want to talk about is behavior, and we really need to get into it to know the background and the definition of what behavior is in order to understand later the components of a functional behavior assessment and a behavior intervention plan. So the definition of behavior, according to Merriam-Webster, is broken into three parts. The first one says that behavior is the way in which someone conducts oneself or behaves. Then it goes on to say that behavior is the manner of conducting oneself, is anything that an organism does involving action and response to stimulation, is the response of an individual, group, or species to its environment, or is the way in which something functions or operates. So what do we think of when we hear the word behavior? Oftentimes, people are going to think of behavior in a negative way. It's often used to describe what a person is doing wrong, but this is not the case with the word behavior. Challenging you guys to shift your thinking to define behavior as an observable and measurable response to stimuli. So what do I mean by observable or measurable? Essentially, it's what do you see happening and what do you hear happening? It takes all of preconceived notions and feelings out of the equation, and it focuses specifically on you as a person. What are you observing with your eyes, and what are you hearing? A little more info on behavior. It's important to remember that behavior is communication. It serves a purpose. It tends to occur in patterns, and those patterns are usually culturally influenced. And behavior can be reinforced. And because it can be reinforced, that gets into the point that behavior can be changed through reinforcement. We can increase desirable behavior and decrease undesirable behavior. Another important thing to bring up, though, is that sometimes as teachers and educators in the classroom, we're going to see behaviors that we're really uncertain of what's going on. These are thought of as stereotypic behaviors. It could be that you're seeing somebody do something and you just don't know why. It doesn't serve like a constructive function that you're looking at. I refer to this as stimming. It can be hand flapping, flicking your fingers, rocking back and forth. It's to get sensory input, and usually it's due to having not had enough movement or activity in an environment, and or just sensory seeking. Maybe the child is seeking that input. They need to feel that rocking, or it feels good to just flap your hands. So what does IDEA, Individuals with Disabilities Education Act, say about behavior? So this is pulled directly from our textbook, and it says that IDEA requires that school professionals use a very systematic procedure to document behavior problems that students display. They need to do this to analyze the reasons that those behaviors occur, and they need to develop and systematically implement interventions intended to reduce inappropriate behaviors and increase appropriate behaviors. So that was a long definition. So what does that mean? That means that IDEA has procedures, it has plans in place for how a teacher or special education team is going to document behavior, what hypothesis they're going to come to after analyzing and looking at the behavior, and then what are they going to do? What are they going to come up with as an intervention that's going to reduce inappropriate behaviors and increase the good behavior or the appropriate behavior that they want to see? Another thing that our textbook said was that a functional behavior assessment or behavior intervention plan is required for all students with disabilities who experience behavior problems, regardless of whether their disability involves an emotional behavioral disturbance or not. I thought this was interesting. I would say, thinking about this and my experience working with behavior, that a BIP is more required when the behavior is inappropriate or maladaptive. The so what factor. So when we're thinking about behavior and working with students, as teachers, we're always going to come across behavior because behavior is communication. And there are things that are probably going to get on our nerves or irritate us. But the questions that we have to ask ourselves when we're thinking about behavior is, does the behavior interfere with the student's learning? Does it cause harm to their peer or teacher relationship? So is it affecting how they're interacting socially with typical developing peers and their teachers? And does it pose a threat to the safety of that student or other people in the classroom? There might be a time where it seems really irritating that a student is like vocally stimming, and that might bother some teachers because it might be loud or it might be done at the wrong time. But the question that you need to answer is it impacting their learning? You need to ask, is it harming anybody? And is it harming their relationship with their peers? If it's not doing any three of those things, then that's a you problem. And so that's where the so what factor comes in, remembering that behavior is communication and asking those three questions to determine if it's something that needs to be addressed. So when we look at behavior, we need to remember that behavior serves a purpose. And because it serves a purpose, that means it has a function. And so there are 4 functions of behavior. To remember the functions of behavior, you can please take a seat, SEAT. And SEAT stands for sensory. Sensory is also thought of as automatic. That's that stereotypic behavior where the child is seeking deep pressure, hand flapping, vocal stimming. They're doing it because it feels good to their body. And it might look like there's no apparent reason that they're doing it, but they're doing it because their nervous system, their sensory system is craving that. The second function of behavior is escape. This is where a child is doing something to get out of a situation or to escape a situation. This could include somebody who's work avoidant or task avoidant and they're not wanting to complete their work. It could also include a child doing something to get them out of a situation. So perhaps the lunchroom is really noisy and they don't want to be in there. And so they might be acting in a certain way to help them escape. The third function is attention. Children will do stuff to seek attention, and it doesn't necessarily have to be positive attention. They will also act a certain way to seek negative attention. And then the fourth one is tangible. And so that's where a child is behaving in a certain way to get something, to gain something. So it could be a toy, a child who wants a toy. It could be access to a favorite activity. And so to figure out the function, we think of how do I figure out the function? Well, to do that, you have to observe and you have to take data. When you observe, you're looking objectively at what am I seeing and what am I hearing? So the main form of data collection that's going to be most relevant to a functional behavior assessment and creating a behavior intervention plan is called ABC data collection. So what does that mean? Well, ABC data collecting is essentially a narrative. It's a recording of what is happening before, during, and after the behavior. It's considered a 3-term contingency because each step is in a relationship with each other. They work together to either maintain or to change a behavior. And again, just to comment on this, that it's really helpful that you be as detailed as possible when you are taking data or bringing up a concern to a special education team, because you don't want to have subjective interpretation. Leave your feelings out of it. We're not describing things as, oh, the child got mad, the child is angry. We are talking about, what did the child do? What did you see? And what did you hear? So what does ABC stand for? The ABC of data collection. So I found this picture at simplyspecialed.com, how to take ABC data. It's hyperlinked at the top in blue, and it's telling us that ABC stands for antecedent, behavior, consequence. The antecedent is what event or action occurred immediately before the behavior. So what was the trigger? The behavior is what the child either said or did. We're making sure it's observable because we're only saying what we saw and what we heard, not what we felt. And then the consequence, that's the C, is what event or action occurred immediately after the behavior. And the consequence is not something negative. We think of, oh, what was the consequence of that? What happened? What was the punishment? And that's not what we're thinking of with consequence. The consequence is exactly what happened afterwards. So if a teacher, say a child threw a toy on the ground, the prompt, like for ABC, the antecedent, their mom says, it's time to clean up. The child throws the toy on the ground. That's the behavior. And then the mom walks over to the child and says, honey, why'd you throw that toy on the ground, and gives him a hug. Well, the consequence is the mom saying, why'd you throw the toy on the ground, and give him a hug. It's not necessarily a punishment. So this is an example of an ABC data sheet, and something that more of the special education team might be using if they're collecting data on students in a gen ed classroom. But this was also found at simplyspecialed.com. It's hyperlinked up there, and it's just an example of what you would include in an ABC data sheet. So when did the behavior take place? Where did it take place? Who was present? And then just that, what triggered it? What did it look like with removing your emotion from it? So what did you see or hear specifically? And then the consequence. So what was the result? What was the reaction? What happened specifically after it? So now we're going to talk about functional behavior assessment, also known as an FBA. So our textbooks tells us that an FBA is a multidimensional and research-based problem-solving strategy for analyzing a student's behavior within the context of the setting in which the behavior is occurring. Breaking that down into more layman's term is that it's a process. It's rooted in the science of applied behavioral analysis. It focuses on gathering data that's relevant and information to determine the function of the behavior. So that's that sensory, escape, attention, tangible. Why are they doing what they're doing? They're seeking a function. And an FBA is used to come up with an intervention that is function-based, that will maximize the effectiveness and efficiency of behavior support. So if you're not coming up with an intervention that has the same function as the behavior that the child is exhibiting, then you're not going to see progress. So that's why it's important to do the functional behavior assessment, to really match those functions to the behaviors to be able to come up with the correct intervention. So why do we need an FBA? Why do we need a functional behavior assessment? Well, we need one because it's how we determine the function of the behavior, and it tells us how to address the behavior. We also need one because it's the first step that needs to happen before we design the actual behavior intervention plan. And the behavior intervention plan is going to help us decrease those challenging behaviors and increase the appropriate ones. Another thing that's important too is that an FBA looks at all the environmental stuff that's happening. So like, where is it taking place? Who's in the room? And then also it looks at functional factors too. So it's taking into account child diagnosis, if they need any adaptive help, and that sort of thing. And it also can tell us why challenging behavior might not, you might not be having the best results with some of the positive behavior supports that you were doing before, because the FBA tells us exactly what that function is and where to go from there. So there are two assumptions of a functional behavior assessment. The first one is that behavior occurs in a context, and that means that it's influenced by the setting in which it occurs. So we need to look at, is it in a certain classroom? Is it at a certain time of the day? Is it a noise that triggers it? Is it a certain person that's always triggering the behavior? You have to look at those things and the context of the setting in order to change the behavior. The second assumption is that challenging behavior serves as a function for the student. Okay, so what does this mean? This means that the behavior has a purpose. It's communication. If you want to change behavior, you have to identify its function, and that's where that take a seat comes back in. We're seeing, is it sensory, escape, attention, or tangible? So there are 5 steps involved in a functional behavior assessment, or an FBA. The first step is to identify the problem behavior. So we are specifically stating exactly what the behavior is, and describing that in observable terms. So what did we see? What did we hear? The second step is that we're going to describe in detail the settings in which the behavior occurs. Did it occur in the gen ed classroom? Does it only occur in PE? Does it happen at 3 o'clock every day? Is it when a certain noise happens in the classroom? The third step is we're going to gather info about the behavior using interviews, rating scales, observation, so ABC data, behavior checklists, filled out by parents. We're going to look at records. We might have things filled out by teachers or others who interact with the child. We might look at health factors, diagnosis, and executive functioning skills. The fourth step is that the team's then going to review the data. So they're going to look at the observational data, and then they're going to look at a comparison between what the teacher's saying, what the parents are seeing at home and saying, and also they might talk to the student if they're capable, and talk to the student about how they feel about the behavior. The fifth step and final step is that you're going to form a hypothesis about the function of the behavior, and you're going to do that based off all the data that you gathered. So taking all of that into context and into effect, you're going to say, okay, what do we know as a team? What does this behavior function look like? Next, we move on to the behavior intervention plan, and that happens after the FBA is completed. So what is a behavior intervention plan, or a BIP? Well, it's a set of strategies designed to address the function of the behavior in order to change it. Who is involved in this process? Well, it's the same people that were involved in the FBA. It's based off of a team. So the team is working together to create the BIP, and it usually includes school psych, the educators that are working with the child, family members of the child, so who are the guardian, and then sometimes the school counselor is also involved in this. So what are we going to include in a behavior intervention plan? Well, we're going to make sure we have those replacement behaviors. This is the whole point of figuring out the function of the behavior. I'm going to read this direct quote off of here. It says, "It's not enough to demand that a student stop their problem behaviors. Their behavior intervention plan team must come up with specific replacement behaviors that serve the same function as the negative behavior." It doesn't make sense to try to teach them a replacement behavior that doesn't serve the same function, because they're not going to get the same input from that they're seeking. A behavior intervention plan also includes rewards and consequences. So it's going to state what specific rewards the child's going to get for using the replacement behavior that we teach them. This typically always includes immediate praise for their target behavior and giving good feedback saying what they did well. It's also going to include effective and logical consequences for when the student does not follow their plan. Behavior intervention plan also might include service-centered resources. So the child might need extra counseling. They might need specially designed instruction. They might need some accommodations. Maybe they're needing some adaptive help or executive functioning help. So you might see some OT, speech therapy, PT, or they might need assistive technology to help them get through their work. The behavior intervention plan also includes environmental changes. So a child might need to be placed in a different seat. They might need to have the teacher do some task analysis for them. That's where they're breaking the steps of the assignment and instructions into small chunks and pieces so that the child can move through those more easily. They might need transition mornings. You might be looking at using a visual and auditory timer. They might need a specific schedule. They might need a quiet place for breaks or break cards. Those are just some examples of environmental changes. The BIP's also going to include responsible persons. So who's responsible for implementing the interventions? And then I'm also going to say that it's important that staff members who work with the student should also be informed on how to implement the behavior intervention plan. Consistency is key for working through behaviors and for extinguishing maladaptive and adverse behaviors. So you want to make sure everybody is on the same page. And then also, the behavior intervention plan is going to include plans for progress monitoring. So it's going to talk about how are we going to collect data. We also need to collect data to identify the successes and the areas that might need to be improved. Or if a replacement behavior isn't working, then we're going to have to go back in and analyze and figure out what do we need to do to get a better replacement behavior, or did we possibly miss a function? And that goes into determining the effectiveness of the behavior intervention plan. And then also it's important to include students and parents. Students and parents should be asked to provide ongoing input of what they think is working and what isn't working with the behavior intervention plan. And finally, something to think about is that the functional behavior assessment and the BIP are in a relationship. You can't have a behavior intervention plan without first having a functional behavior assessment. You can't have a functional behavior assessment without first collecting some data and being observant. So we need to think of a functional behavior assessment as like a diagnosis of what the function is of the behavior. And then the behavior intervention plan is like the prescription. Like you would go to a doctor, you're sick, you'd get given a prescription. So the BIP is like the corresponding prescription to the FBA. An FBA is also an evaluation to define a student's problem behaviors, along with possible reasons for their actions. So we're thinking again, why is the student behaving the way they are? Leaving out our emotions, figuring out the function, giving them a correct replacement behavior to serve that same function, and then reinforcing that through reward and praise. And then based on the functional behavior assessment's findings, the BIP provides strategies that teach the student the new behaviors to replace the inappropriate ones. So it all works together. They're contingent on each other. This next slide shows some resources for teachers. And so everything is hyperlinked. The first link is a brief packet on functional behavior assessment. It's like 30 pages. It gives you all the information you could possibly want on what a functional behavior assessment is. And then it also has blank pages for practice or to work through behaviors. The next link is a blank copy of the Office Superintendent Public Instruction Functional Behavior Assessment document. So that's the one that they have listed on there. It's blank. You can click on that and look at that. The next one is also from the same place, but it is a behavior intervention plan blank document that can be filled in. And then the last link is from the Office Superintendent Public Instruction, and it's talking about behavior and discipline. And so it's their webpage on that, and it includes everything that you might possibly want to know about FBA's, BIPs, and behavior intervention on that website. And then here are my references. I thank you guys for listening to my presentation on functional behavior assessments and behavior intervention plans.